Good morning, everyone, and I'd like to welcome all members, staff, and guests to the October 23rd, 2023 Haldeman Norfolk Health and Social Services Advisory Meeting. I'd like to remind everyone that our meetings are web streamed and televised. With that, I call the October 23rd, 2023 Haldeman Norfolk Health and Social Services Advisory Meeting to order. Are there any declarations of pecuniary interest? Seeing none. Any additions to the agenda? None. There are no presentations or deputations. So we'll move on to the adoption of the advisory committee meeting minutes. 4.1 Health and Social Services Advisory Committee, September the 27th, 2023. May I have a motion to approve the Haldeman Norfolk Health and Social Services Advisory meeting minutes from September the 27th? Can I get a mover, please? Thank you, Councillor Linda, seconded by Councillor Metcalf. All in favor? Carried. Thank you. Are there any updates on previous reports? I think Sarah Page will provide us with an update. Thank you, Sarah.
Good morning. Just letting everyone know that all three reports that went through were approved at Board of Health and Council.
Thank you. Are there any consent items? Seeing none. Staff report 7.1. Sarah Page will provide an update on those. Thank you.
Thank you. Just a quick update from the general manager position. It's been about 3 weeks in this position, so I'm learning a lot. I've had some initial meetings with Matt Bowen and the team at Haldeman Norfolk Housing Corporation. Had an initial meeting with Brent Feeney from the Ministry of Health. And I've attended both a strategic planning meeting with the leadership team at the health unit, but also our in-service that took into account most of the staff from Health and Social Services. We had over 100 in attendance. I do have a meeting scheduled with Haldeman GM Corporate and Social Services and the Manager of Legal and Support Services with an expected visit to the CAO as well in mid-November. And we're working on having both of our Ontario health teams from both Haldeman and Norfolk present at the next board advisory committee, and that would be the November meeting on the 27th. I also wanted to announce that Dr. Joyce Locke has been extended in her acting medical officer of health contract. We did have a very limited amount of time to address this, and thankfully Dr. Locke was keen to stay on and assist us through our annual service plan in March, the current strategic plan process that is ongoing at the health unit, and the new MOH strengthening public health process. We do value her expertise and guidance as we travel through these major projects. She has agreed to stay on until potentially June of 2024, and any further options or changes moving forward will come to this committee prior to any initiation. We do apologize for the oversight in some of the process of this extension and commit to better transparency in the future. That's all I have to report. Thank you.
Thank you, Sarah. 7.2, public health. Dave? Oh, I'm sorry. So I'm going to report on health update.
Thank you. And my report is self-explanatory. I'll just highlight that the Health Transformation Task Force of the Association of Municipalities of Ontario was set up in August, from what I understand, at least the new form of it. And we will be carefully watching what comes out from that Transformation Task Force. It will be looking at public health as well as other health system issues. And if there's anything relevant to public health, I'll share that in future meetings. With respect to strengthening the public health, which had 3 prongs, one of which included the merger. The other one that is of significance is that they're reviewing the Ontario Public Health Standards. So I'll give you updates as we go. With respect to the merger issue, there's a key informant table that's been assembled with representation from Alpha, Homo, other sectors, including AMO, is from what I understand. And they are going to come up by the end of this month with their further details and recommendations on the criteria and objectives around the merger. So we're waiting for that to help us when we start to speak with the consultant that we're going to hire to look at what the interest of our local stakeholders are around the concept of merging. I think those are the only two really relevant. The rest you can read for discussion. Thank you.
Thank you very much, Dr. Locke. And you may continue your presentation for the 7.2.1 Medical Office of Health Update, HSS 23063.
Yeah, I just did that.
You just did that. Sorry. I thought
sorry
you were
if I
from
got
the
it
public health merger. Okay, thank you. Item 7.2.2 respiratory season, HSS 23-052. Saeed, Director of Public Health, please introduce staff, and staff will present the report. Thank you.
Madam Chair, we need to receive the medical officer health report as information. I could move that.
See, that's the difference. Could we receive the medical office of health update report, please? So can I get a motion? Thank you. Moved it. You'll second it. Thank you, Councilor Linda. All in favor? Carrie, thank you. Go ahead. Thank you.
Thank you. Through you, Madam Chair, I would like to introduce Sarah Titmus, Program Manager for COVID-19 program, to present this report. Thank you.
Through you, Madam Chair, to the board. Good morning. My name is Sarah Titmus, and as Syed mentioned, I am the Program Manager for the COVID-19 response team. I have both the infectious disease and COVID response team within my portfolio, and today we'll be presenting report number HS 23052, respiratory season, and ask that the advisory committee accept the report as information. So what is respiratory season? Well, this is known as the time between November 1st and April 31st, when respiratory viruses are circulating at their highest in our communities, and infections from those viruses, in particular influenza, tend to peak. Monitoring and surveillance for respiratory viruses does occur all year long, and this has shown that in the case of COVID-19, that this is not a seasonal respiratory virus, but rises and falls in numbers all year long, which is typical for a novel coronavirus. So why does this matter? Well, respiratory viruses generally affect the respiratory system, causing symptoms such as fever, cough, runny nose, sneezing, sore throat, headaches, and muscle pains. All of what in most cases would be a common cold in many people, it may become severe illness due to worst infection, leading to bronchitis, laryngitis, sinusitis, ear infections, or pneumonia. And on top of that, those at higher risk for illness, so people aged 60 plus, immunocompromised persons, pregnant people, First Nations, Inuit and Métis communities, international agricultural workers living in congregate living settings, residents and staff of long-term care retirement homes, and those unvaccinated are also at risk for severe outcomes such as hospitalization, long-term side effects, chronic conditions, and even death. So what is the public health burden to the community? Well, in order to understand the public health burden for Haldeman Norfolk, the health unit undertakes surveillance and monitoring of respiratory diseases. This is conducted through receipt of positive lab results for cases of COVID-19 and influenza A and B in our jurisdiction, as well as report of symptoms of acute respiratory illness in our high-risk settings. So for our highest risk settings, we would receive positive lab results for COVID-19 and flu, as well as those for acute respiratory infections that go on to be identified as things like parainfluenza, rhinovirus, human metapneumovirus. For overall respiratory virus activity, you will see in the graph on page 4 of the report that influenza A and B follows that traditional seasonal pattern, peaking in November and tailing off into April. And in contrast to that, COVID-19 demonstrates peaks and troughs throughout the entire surveillance season. While COVID-19 is no longer in its pandemic phase, our communities are continuing to experience illness due to COVID-19, and influenza cases have also continued to rise as COVID-19 related public health measures were further relaxed across the province. From an outbreak perspective, the majority of outbreaks in our institutions tend to be caused by an acute respiratory illness. However, COVID-19 is the exception, since it has caused institutional outbreaks throughout the year during the pandemic period of 2020 to 2022 and continues to do so post-pandemic. So what as a health unit do we do about this? What is our role in respiratory season? Well, there are four main focuses for the infectious disease and vaccine preventable disease teams during respiratory season. These include vaccinations. So our Ministry of Health has once again launched its COVID-19 influenza vaccine campaign. Vaccines are aimed at reducing the risk of severe illness from these two viruses. And COVID vaccine clinics are now offering the XBB vaccine, which will target the most recent Omicron strain. And for influenza, a high-risk quadrivalent vaccine for high-risk people is also available at local pharmacies. Both the COVID-19 and influenza vaccines will be made available to the public towards the end of October. And finally, on this area, the Ministry of Health has also announced public funding for the RSV vaccine for those 60 years and older living in long-term care home, elder lodges, and some retirement home residents. Our next focus, which is a large one, is health education. So this is a key piece to prevention of illnesses from respiratory viruses. It's aimed at promoting an understanding of how to maintain personal health. This would then also influence population health by decreasing not only individual cases of respiratory virus infections, but also outbreaks of respiratory illness. Our key health messages are to get vaccinated, practice hand hygiene and follow respiratory etiquette, stay home if you are sick and don't visit high-risk settings such as long-term care and retirement homes, and know your risk for respiratory viruses and get assessed. Information on all of these topics in relation to respiratory season are available on our website and social media platforms, with radio ads and targeted messaging planned for the winter months. In particular, as well as being up to date with your vaccines, it is important to know your personal risk level for COVID-19 and influenza. This is a newly focused health education message. Those at high risk for severe outcomes from COVID-19 should have access to COVID-19 tests at home. And those at risk for both COVID-19 and influenza should speak with their healthcare provider and pharmacists to develop a treatment plan in advance in case of potential infections. Our third is surveillance, which we've talked about already when we looked at the public health burden of respiratory viruses in the community. This is also conducted at the international, national, provincial and local levels. Local level data gets rolled up for inclusion at an aggregate count level and assists with assessing the effectiveness of the influenza and COVID-19 vaccines, as well as controlling the spread of respiratory viruses. Needless to say that the work carried out at the international level starts with local level surveillance and management of respiratory diseases by our healthcare providers, hospitals, institutions and public health units. And last but not least, our fourth focus is on outbreak management. This focuses predominantly on our highest risk settings, including long-term care homes, retirement homes, hospitals, etc. This approach includes collaborating with facility staff to define and investigate cases and contacts in the outbreak area, testing for respiratory viruses and ensuring antiviral medications are in place, infection prevention and control guidance, and recommendations on surveillance strategies. Looking at our outbreak pattern in our institutions during the last respiratory season, there was a total of 44 outbreaks, which is approximately 56 of the confirmed outbreaks managed for the entire surveillance season. Such a concentration of outbreaks requires the ID team to prioritise outbreak management and follow for high-risk diseases of public health significance during this time. So with all that being said, what can we do to help? Well, as the advisory committee, you are respected members of our community and can be advocates for this important public health initiative. And so we ask that you speak positively about the benefits of immunisation, get your flu and COVID vaccine every year, practice hand hygiene and respiratory etiquette, stay home if you are sick and don't visit long-term care retirement homes, and in particular for this respiratory system, know your risk for respiratory viruses and get assessed. Thank you. I'll open it up to questions.
Thank you, Sarah. I think we have a few questions. Go ahead, Councillor Linda.
Thank you very much. First, I'd like to acknowledge the fact that Sarah, I don't know if I need a hearing test, but I found it very choppy and I really couldn't understand a lot of it. So am I speaking out of turn or what's going on? It was, so out of that, I heard a lot of what the priorities you were thinking, get immunized, get this. Could you repeat those in a very brief form so that, because most of, to me, the majority of your report, I couldn't comprehend because of it was so choppy. So if you just could go over those few facts that you said, starting with the fact that we should all get immunized.
Yes, of course, and through Madam Chair to the board. So the messages were get immunised, practice effective hand hygiene and follow respiratory etiquette, stay home if you're sick and don't visit high-risk settings, and know your risk for respiratory viruses and get assessed. I hope that was much clearer.
Thank you.
So on page 17, it's okay, Sarah, I'll read it out then. It is get vaccinated, practice effective hand hygiene and follow respiratory etiquette. Stay home if you are sick and know your risk and get it assessed. Just a little quiet in here sometimes when you're on these teams. Any other questions for Sarah? No? May I have a motion to approve the respiratory season report H&SS 23052 as information? Thank you, Councillor Metcalf as a mover, seconded by Councillor Van Rishi. All in favor? Motion is carried. Thank you. 7.2.3 Haldeman Norfolk Unit Funding and Accountability Agreement Budget Amendment H&SS 23-059. Saeed Shah, Director of Public Health, will introduce staff, and staff will present a report. Thank you.
Thank you. Through you, Madam Chair, I would like to introduce Michael Van Sickle, Senior Financial Analyst, to present this report. Thank you.
Thank you, Syed. Through the chair to committee. So report H&SS 23059 being presented is in regard to the most recent accountability agreement between the Ministry of Health and the Board of Health for the Haldeman Norfolk Health Unit. For some background, the Health Unit submitted the 2023 Annual Service Plan in March based on the Board of Health's approved 2023 operating budget and allowable one-time funding requests. On August 29th, the Ministry sent approved funding allocations to each Health Unit. For base programs, the Ministry communicated before the release of agreements that all Health Units would receive a 1% mandatory programs funding increase for the years 2023 to 2025. For the Haldeman Norfolk Health Unit, this amounts to an increase of $41,175 for 2023, as seen in Table 1. Due to the Ministry operating on a fiscal year, the Health Unit will receive an additional $13,725 in 2024. There are no other adjustments required for base programs. For one-time programs, requests have been split into Tables 2, 3, and 4. Table 2 outlines the calendar year requests, of which all 3 were included in the approved budget. As expected, the Ministry has confirmed mitigation funding and furthermore announced that the cost share will return to a 75 provincial, 25 municipal split from the previously reduced share of 70-30. This change will be reflected in the proposed 2024 Board of Health budget. COVID programs have not received an approved allocation. However, the Ministry continues to fund eligible costs at 100%. Table 3 gives the fiscal year requests with programs for a public health inspector practicum program, a new vaccine refrigerator, and secure card access requiring a budget amendment. The school-focused nurses initiative and the strategic option analysis were included in the approved operating and capital budgets, respectively. Finally, Table 4 provides the requests that did not receive funding approvals from the Ministry. The Ministry has communicated that there will be an opportunity to apply for in-year funding. However, it is not yet known what specific projects will be deemed eligible to apply for. And with that, Syed and myself would be happy to answer any questions. Thank you.
Thank you for that. Are there any questions? Councillor Duffy?
Excuse me. Thank you, Madam Chair. And through you to staff, I wonder if you can maybe talk us through a little bit more about Table 4, the one-time program funding that's not approved, what those items were and how that would impact our operations.
Thank you. Through you, Madam Chair. So there were three requests which were not approved. The first one was we asked 30,000 for our strategic plan. So in the year, this current year, 2023, so Board of Health already approved $20,000 for strategic planning. But we asked Ministry of Health if they can give us $30,000 so that we can offset the levy. So this is not approved, but we are moving ahead with our strategic plan because Board of Health already approved that strategic capital plan funding for 2023. So that is first. Secondly, website modernization. In our community needs assessment, there were some comments from the community that public health unit website, it needs modernization, and we did not put forward a funding request or a capital request to Board of Health. So we asked Ministry of Health if they can fund us to modernize our website. It did not get approved. So we need to work with IT or with our staff as well, how best we can modernize or update our website without having this funding. So that is second. The third one is electronic medical record. This is what we are asking Ministry of Health for the last 3 or 4 years, that we need to integrate our systems because we are using various systems for our various programs. Like, for example, infectious disease program, it has its own database. For vaccine preventable diseases, it has its own database. So sometimes we face challenges when we want to retrieve records from, let's say, for example, from hospitals. So we want to have electronic medical record where all the records of our clients, they can be centralized. But ministry did not provide us this funding. But there is an update from Ministry of Health that Ministry of Health is working on a centralized database that will be rolled out to the whole province. I don't know how much time it will take, but there is some progress going on there to have a centralized database for the public health units. Thank you.
Thanks for that, Fayed. My comment would be, it sounds like these are all three are things obviously that we need to move forward with. I appreciate that number one we're doing anyway, but website modernization is important. Record management is important. So if there's a way that we can move forward on those initiatives using our in-house resources as best we can, that would make sense to me. Thanks for that.
Thank you very much, Councillor Duffy. Any other questions, comments? Nope. Councillor Vandersheek.
Thank you, Madam Chair. And through you, I'd like to comment that I think Councillor Duffy is absolutely correct. If we could use in-house staff to try to help with that, that would really make a difference because your items are vital and important. So it's important that we try to use what we have as well, and hope that we can get assistance and more funding. So I like the idea of using in-house. So thank you.
Thank you very much. Councillor Van Passen?
Thanks, Madam Chair. If I get the big picture right, we're going to have a net gain of $125,000 from provincial funding. So that's correct. Maybe you can do the business case on reallocating the 125 we in essence just saved for one of these programs or partial getting them started that we can look at budget time. Is that possible?
Thank you. Through you, Madam Chair, that's a generous offer. I'll have a discussion with my team and we'll get back to you on this.
Any further questions? None. I have a motion to approve the Haldeman Norfolk Health Unit Funding Accountability Agreement Budget Amendment, H&SS 23059, as information, and that the approved 2023 Haldeman Norfolk Health Unit operating budget be amended to include $125,200 in base and one-time funding, and that the Board of Health endorse the delivery of one-time programs as outlined in the report. Can I get a mover, please? Thank you, Councillor Van Passen, seconded by Councillor Duffy. All in favor? Carried. Thank you. If There's nothing under subcommittee reports. Communications 9.1 Alpha October info break. This is for information purposes only. Other business 10.1 terms of reference review. Councillor Van Passen requested for this item to be added to the agenda. May I ask that you start the conversation? Thank you.
Okay, thank you, Madam Chair. Last little bit, or well, last few years already, we've had some issues getting a quorum once in a while and members being absent. And I know everybody has conflicting schedules. There's a lot of reasons. And I wonder whether it'd be worth amending the terms of reference so that each municipality could appoint an alternate for this committee. And my thoughts behind that was if one of the members can't make it, it would be their responsibility to contact the alternate to replace them on for that particular meeting. So it would be a matter of sending it back through our clerk's department, I think, to adjust the terms of reference. And we could set that up if other members think there's a need for that.
I think that's a great idea. I would like to see that go forward, and absolutely, if you can't make it to the meeting, then reach out to the person that's the alternate. Can I ask for a motion for that, please, for that amendment? Councillor Patrick? Do you want me to read a motion, or do you?
Oh, sorry. I thought you just wanted to get it put through.
Yeah, I need to get a motion on the floor, right? Correct?
It-
you, Chair. Yes, we do need a motion. However, I would ask, can I just clarify a couple of things before we redo the terms of reference? If each council is able to appoint an alternate that may come, is it only their own alternate that may represent? So Haldeman members being absent would only be represented by their alternate. That would keep
Yes.
the balance at the table.
That's correct.
And then just a motion to add an alternate into the terms of reference. I'll bring back a draft terms of reference upon committee's approval. It'll then go to council for their approval and a motion to appoint an alternate at each council table. Does that make sense?
Yep.
Okay, thank you.
Mm-hmm. Okay, so we direct staff to provide the motion and to get it passed through council to have an alternate for each county in case one of our members cannot attend the meeting. It's important to carry on with these meetings as they come about instead of having it deferred. So appreciate that. Thank you. Can I get a mover, please? For Metcalf, seconded. Councilor Van Passen, carried. Nope. Sorry.
Thank you. For you, Madam Chair, just to step back to the Alpha information break. Just draw the committee members' attention to the Alpha Fall Symposium and Workshop on November 22 and 24. It is virtual. So even if you can just pop in and out of part of it, it would be appreciated. Thank you.
Okay, thank you. We can just go back to that motion carried, and then I'll go back to that. Thank you. Can we get that all in favor, please? Thank you. You, Carrie, thanks. And thank you for the information, Dr. Locke, on the Alpha. Sure, go ahead, Councilor.
Through you, Madam Chair. How do we connect then? Where would I find that information? And I'm looking for it. Can you just redirect me to what page I'm supposed to be so I can pull it from the package? Dr. Locke, what page would that be on for the connection? Mm-hmm. 50. Does 57 have the actual? How do I connect? Oh, here, okay. Okay, oh, okay. Well, I'll touch base if we can't,
It's in there,
mhm.
and I can have Christina be in touch with you, give you specifics,
Okay, that would be great.
get you signed up.
Yeah,
If
thank you.
are available.
Thank you.
You, Madam Chair, it's on page 55.
But I thought the first,
Yeah, and there is a link, ma'am, here. Register here.
register here, okay, okay. Thank you.
No problem.
Hold that.
Okay, thank you. Sarah?
My apologies, through the chair to committee. I just also wanted to add, I think it's really important with our alternates that they are in the circulation of information as well. So when that happens, that they get all the same information so that they are kept updated with all the meetings as we go through. So I just wanted to ensure that I'm not sure if that has to be changed in the terms of reference, but that they would also be added to all the information in circulation.
Great idea. Thanks, Sarah. Moving on, we don't have anything in our closed session. Next meeting is Monday, November the 27th at 2023. We'll move on to adjournment. May I have a motion to adjourn at 10:02? I have a mover. Thank you, Councillor Metcalf. Seconded. Councillor Van Passen, thank you. All in favor? Carried. Thank you.